Well, many of you are continuing to roll in as we get to the top of the hour. We'll be starting our webinar in just a moment. Again, just a reminder, you're in the right place. And this is, as I mentioned earlier when we first opened the room, this is our 13th shared partnership with the IAVM and Venue Solutions Group, free webinars since COVID has started, trying to help all of us navigate through the craziness we've dealt with. So at this point, you know, my great pleasure to turn it over to my business partner and the head partner at VSG, Russ Simons, who's going to be our facilitator, and he'll introduce our panelists, and we will get off and go in here. So good morning and welcome.
Hey, thank you, Richard, and thank all of you who have carved out some time to spend with us on this subject. This is going to be a discussion. I think that while some of us have done vaccine verification, I was mentioning to the panel as we were waiting to get started, we did our first event on June 20th that required vaccine verification, and the next one I do won't look anything like the first one. The nature of what is going on around us is changing on a weekly basis, sometimes on a daily basis. And so the idea here is to have this discussion. We've got some terrific panelists who have experience. And then what we're going to do is get to your questions. I'm going to start with some questions of my own, and then we will ask you to put your questions in the chat. And that's a very efficient way for us to be able to go down through those and make sure that we address everybody. So we'll have a discussion for about 45 minutes, and then we'll start to address the questions. And we will stay on as long as we need to stay on to make sure that everybody gets their question answered. Before we actually get to the panelists, though, it's my great pleasure to introduce to you, representing the International Association of Venue Managers, Mark Herrera. VSG and IAVM have a terrific partnership, which also includes the upcoming Venue Operations Summit. We've tried really hard to produce content in partnership with IAVM that is meaningful to all of us as operators and people in the industry. And so, Mark, perhaps you could say a few words from IAVM's perspective.
Thank you, Russ Simons. It's truly a pleasure. First of all, on behalf of IAVM and the Venue Solutions Group, we welcome everyone on this call. You know, it's truly a pleasure to partner with the Venue Solutions Group, and we know that right now the vaccine verification deserves special attention. There's a lot of questions in general regarding vaccinations, which is on the forefront of the entire event industry. But it's so important that we collectively, through all of our valued partnerships and IAVM, continue to prepare, respond, recover, and try to make sense of this entire pandemic and try to restore the venues back to safe, operable event spaces, but also to assure that we follow all health practices and protocols. So it's important that we provide that guidance that is designed to help venues make reasonable decisions as it relates to the health and safety of its occupants and all of the employees that manage those facilities. To Russ's point, the Venue Operations Summit is something that we are collectively putting together to really bring forth to the industry, so stay tuned for that. And I just want to also give a shout out to all of our committees. Many of those that are attending this this particular webinar are probably committee members, folks that represent all different types, facility types, organizations, etc. So we hope that we meet and exceed your expectations and give you something that you can actually take back and know and understand and sort of make sense of something that we're all trying to power through. With that, it's a pleasure to be on this panel with Brian, Richard, Adina, Raul, and Russ. Russ, back to you, sir.
Hey, thank you, Mark. We appreciate you as always. I mentioned that we're going to treat this as a discussion with some presentation from the participating panelists. There's also some caveats that are really important. I want to make sure that somebody in Oregon or Idaho doesn't go, well, we're doing this because Russ Simons said to do it. What's happening right now throughout our country is it's as diverse as the 50 states. And so everything that we talk about is going to be from the perspective of each one of us. And you need to take that information back to your local operating environment, your local health department, your state health department, all of those kinds of things, because each of these is different. I spent a lot of time working and helping people in each of our states, and some of the disparity is really stands out. So this is a work in progress. We're attempting today to try to get some actionable information in your hands. I mean, if you look at VenueNet, VenueNet. There's been tremendous dialogue in VenueNet of people who are saying, hey, we need some help, and who knows anything about any of this. And so I doubt anybody on this panel today would consider themselves to be experts, because the needle is moving, as I said, weekly, daily, with the president's announcement that includes large-scale facilities for vaccine verification. I will share with you that we received information that in Los Angeles, where we had not been mandated for vaccine verification for mega events over 10,000, there'll be an announcement today that we will be moving into mandatory vaccine verification in stadiums and outdoor facilities, whereas indoor facilities over 1,000 were already mandated to have the vaccine verification. So there's a lot going on. Many of you know I like the phrase of building the airplane while we're flying it. So once again, we find ourselves in the cockpit together. And so having said that, then what I want to do is I'm going to ask each of our panelists, and I'll introduce them as we switch over. But I'm going to start with Adina Erwin, the general manager of the Barclays Center in Brooklyn, New York. And really, New York as sort of the epicenter in many ways of almost everything. I just would like Adina to talk a little bit about what the landscape was on the ground, what the information and communication was about moving and the decision-making to moving to vaccine verification. What was the plan like? How did the plan get communicated? How was it executed? And what she and the fine staff there at the Barclays Center learned. And so, Adina, to turn it over to you.
Well, good afternoon, good morning to those of you on the West Coast as well. And as Russ said, it has felt like we have been building the ship as we have been sailing from almost day one, even before the latest iteration of a mandate came out. So in New York on the ground, probably in July, August, the environment here in New York is definitely one of compliance. Prior to the New York City's key to safety, the people were wearing masks, inside all, indoor facilities already. And we're complying with those types of things. But I think that in response to the fact that the numbers, as far as people getting vaccinated had slowed down quite a bit, as well as with the COVID variant starting to become on the rise during that time period. And going into the fall season, I think the mayor of New York, Mayor de Blasio, felt like an extra step needed to be taken. And so on August 16th, he came out with the key to New York City, or the key to NYC, which basically mandated that anyone entering certain types of establishments had to show proof of vaccination, proof of at least one shot vaccination in order to be able to enter those entities. So one of the entities that he encompassed under this mandate was indoor entertainment facilities, which includes sports arenas. So all the sports arenas in New York City, which would include Madison Square Garden, fall under this mandate. And so, like I said, what the mandate basically says, put simply, is that anyone entering these venues, fans, patrons, for an event, would have to show evidence of at least one shot vaccination. So that went into effect on August 16th. It was announced. We were given about a month to comply before they started to enforce. So on September 13th, which was Monday, was actually the day that they would start to enforce. And so in essence, enforcement meant that they would have people or organizations, city organizations coming around checking to see if the people that are in these establishments, which also included gyms, et cetera, had people in them that had proof of vaccination, proof of that one shot, and their fines associated with that. So with the first incident of finding someone in your establishment that's not vaccinated, it's a $1,000 fine, and then it potentially goes up from there depending on the severity of the situation or the frequency of the violation. So what we ended up doing is we were already kind of in a place here in New York City, but even in our operation where we were doing some aggressive kind of screening in general in order to get into the venue because of New York State. So New York State had guidelines long before New York City came out with this mandate. So New York State's guidelines were that if you had more than 5,000 people in your venue, you would have to mandate that everyone was masked, that people had to either evidence vaccination, full vaccination, 2 shots, and they would have to have had 14 days, have been 14 days since the 2nd shot, or you would have to be tested, and you could take an antigen test on the day of entering the venue, or you would have to evidence a PCR test taken within the last 72 hours. So a negative PCR, a negative antigen test. So we were already in a place of having to verify vaccination status or testing a negative COVID test. So we were already in that space. So when this particular mandate came out, which does not allow for any testing, so there is no testing option with this mandate. You have to be vaccinated. You have to show proof of at least 1 shot. We were already, I think, at a place where we could accommodate that verification process, which happens right now at our doors. So when you come to an event at Barclays Center, there's like now an extra check that exists. So before COVID, you would come in, you would go through the security screening, you would get your ticket taken. So now what happens is you actually get your vaccination verification, and before, of course, your negative antigen or PCR test documentation checked. Then you would go through the security screening, then you would get your ticket taken. So we were already in a place where we were have a partner that helps us with checking for those vaccination cards. In the state of New York, there is an app called the Excelsior Pass. So if you received your vaccination shots in the state of New York, that data is in their database. This Excelsior Pass program is a state-sponsored kind of app, and so you can have your information uploaded into that, and there's like kiosks that we scan those Excelsior passes for proof of vaccination. But then a lot of people come with just the plain vaccination card, and therefore our people are checking those dates. So we're currently doing that with the events that we have. Again, we haven't had any events since the mandate actually went into place. That just happened on Monday, but our first event happens Friday with the New York Liberty, and then we have on Sunday a Mark Anthony concert where we anticipate people coming that won't have evidence of 1 shot, and we will be in a situation where we will be having to either provide a refund or for Liberty potentially be able to offer some other invite back for a future game or something like that. So we do anticipate that being something that we'll have to deal with when people show up. We have had a lot of refund requests that have come through, sent people back to their points of purchase. Once this mandate information came out, a lot of the events that, of course, that were downstream of the September 13th deadline, a lot of people started to go and actually ask for refunds. But I think that we haven't seen all of what ultimately is going to land on our doorstep when it actually happens. A few other things about this particular mandate that makes it a little bit more complicated to implement on the employee side is that the mandate is only during event time. So, from the time you open doors, as it pertains to our event, to the time the event is over is what the mandate actually covers. So non-event times, you technically could have people in your building, your employees in your building that are not vaccinated. Or haven't had evidence of the 1 shot. And you could have vendors in your building as well. So someone laying carpet, doing construction, those types of things, if it's during a non-event time, or your stagehands who are loading in or loading out of an event, which is not considered an event time. You have those types of situations where you're able to manage your staff. And so when this came out, probably our biggest anxiety space dealt with employees and our ability to be able to get the number of employees that we would need to work events that are vaccinated. Because what we found is that the majority of our employees were vax resistant, quite honestly. So going into this, we probably had less than 20% of our part-time employee base vaccinated. And so some of the things that we put in place there is we, launched a sweepstakes to try to encourage employees to get vaccinated. And that sweepstakes is actually ongoing now, where every week we have cash and prizes where we do a drawing we pull out 5 names, and we, if you're vaxxed, but you enter the drawing based on the number of shifts that you work. And if you have to be vaxxed in order to be able to enter that. And then we draw names, 5 names a week, and there's cash and prizes associated with that, with a big mega prize that happens at the end of the year of $25,000. So that's ongoing. Everyone that we're hiring and began to hire as of August 16th has to be vaccinated already in order to work for us. This is a heavily union environment, so all of our part-timers, for the most part, and all of the trades are all union. And we didn't have to go back to the bargaining table around the vaccination mandate because it is a mandate, it is a law. So in CBAs, if it's mandated by the local, state or federal government, it's not something that's mandatory bargaining. But if we wanted to implement any type of progressive discipline associated with the mandate, or not the mandate, but the vaccination piece, then we would have to go back to the table. But initially, as far as telling all of our employees that you have to evidence 1 shot by September 13th, we didn't get any pushback from the unions on that. So we're still in the process of trying to build our employee pool around this new mandate and making sure we have enough event-driven positions like your ushers, your ticket takers, your security officers, et cetera, to be able to work events at the level and volume that we need them to be. Because again, we're working with a population of people who are not apt to get vaccinated. So that's probably been the heaviest lift that we've had so far with this new mandate. So I hope I kind of gave a pretty good summary of that, and definitely will be around to answer any questions.
Yeah, and we're going to address the questions at the end. Thank you, guys. You're really heating up the chat, and you can see the number of things that that are on everybody's mind. It is interesting, Adina, that you're a 1-shot qualifier, but no testing. And I know we're going to talk a little bit about that before, because that's very different than Los Angeles or any other communities. Next, we're going to go to Brian Yost. Brian is the COO of the Las Vegas Convention and Visitors Bureau. And I was really interested in Brian. I've known Brian a little bit, and I'm really interested because he brings a destination perspective. I mean, it's easy for somebody like Adina or Raul at Allegiant Stadium, myself, SoFi, those kinds of things. But it's good to have some scale and understand that these things don't just affect us in the sports and entertainment world, public assembly facility, but they affect the communities at large. And one of the things that I've learned about what's happening in the convention business is that a lot of this is being left up to the individual promoters or people who are booking those events. So really interested, Brian, in hearing from you in terms of sort of what you're hearing in Las Vegas with regard to the destination portion of this discussion.
Sure. Thanks very much, Russ. And thank you for the opportunity to participate today. I'm learning lots already. So Adina, thank you. Lots going on in Las Vegas. We have not quite made it to the vaccine verification mandate stage yet. At the end of July, the Nevada governor issued Emergency Directive 47, which required masks in all public places. So from grocery stores to casino floors, everyone is expected to wear a mask. On August 16th, the governor issued Emergency Directive 49, and that provides an option for events that are willing to go fully vaccinated to do so and request an exemption to the mask mandate. That emergency directive was specifically targeted at seated events in venues of over 4,000 seats. And I know Raul's going to speak about the incredible experience at Raiders Stadium. I had the opportunity to attend the game on Monday night and and they've nailed it. They've done a great job with it. That emergency directive is what provided the ability for Allegiant Stadium and other large event venues over 4,000 seated to be able to do that. On September 2nd, the governor issued emergency directive number 50, and that expanded the mask exemption opportunity to other venues over 4,000 people in capacity that aren't necessarily seated show type venues. So to that end, we at the Las Vegas Convention Center have started to have a number of clients who've reached out regarding the ability to do an unmasked show and follow vaccination verification guidelines. The guidelines that have been established in order to receive the exemption, the mask exemption, include many of the things Adina just talked about. So among other things, the group has to be over 4,000 people. The event needs to be for a defined period of time. That can be in terms of hours or days. There needs to be a secure perimeter, a physical secure perimeter around the venue in which the event is taking place. There needs to be a verification of at least one vaccination. What's unique with the governor's most recent emergency directive and that for number 49 as well, is while it provides for the opportunity for folks with only one of the 2-shot regimen to attend events that are vaccinated, those folks with only one of the 2-shot regimen are still required to wear masks. So then the exemption is also, it also provides for a contingency of some sort of wristbanding that a 2-shot or a fully vaccinated 1-shot Johnson & Johnson person would get a green wristband and a yellow wristband for someone that has one of a 2-shot regimen. And the expectation is the yellow wristbanded folks would continue to wear their masks. It will be interesting to see, as I said, we've had a number of clients here at the Convention Center that have started to express interest in that. And we are working with them now to understand how we can provide those secure perimeters and how we can assist. It seems as if I know New York has the Excelsior Pass. It seems as if here at the Convention Center, and as I talk to my colleagues around the destination, it is the Clear Pass that is the vaccination verification tool of choice, with many folks, both our clients and clients at casino properties up and down the Strip, choosing to use that as their means of verification. It is up to the show, as you suggested, Russ, as to whether they wish to do a fully vaccinated show or not. There are pros and cons, and what we're hearing from our clients is they are optimistic that they will be able to drive both their exhibitor and attendee participation by offering a fully vaccinated environment. It's really the mask consideration, or the ability to remove masks, is a secondary concern for them. But most importantly, they are interested in the fully vaccinated environment as a way to drive attendance and build confidence in the safety of their shows. So we are, and we're seeing that up and down the Strip here throughout actually the Las Vegas Valley. Good compliance with the mask mandate. And again, from grocery stores to casino floors, folks are being diligent. Even at day clubs and midnight parties in clubs, folks are being pretty diligent about wearing their masks. It's actually been surprising, frankly. And the venue operators have done a great job through their security staffs and others of helping to enforce that mandate.
So an interesting solution on the wristbands between the green and the yellow, and making sure that there's mask compliance in that. I think that's sort of one scheme. I think we might hear about a number of other ones as people are trying to adapt their unique rules to a set of circumstances that, it seems like there is more flexibility and not less. So next, I'd like to go to Raul Gutierrez, who is the Vice President of Operations for Allegiant Stadium. And I've spent a lot of time on the phone with Raul as we both have stadiums opening this year. And really, as Brian talked about the governor's rules and the choice of how to go ahead and adapt that, because you've just executed this, Raul. If you could just, in a similar way, take us through sort of where you were, what you plan to do, what you learned, and what advice you might have in this for the people in our audience.
Hey, thanks, Russ, and thanks for the invitation. Good morning, everybody, fellow panelists. Good morning, Adina. A little special place for my heart for that building. So glad to see you there. With that being said, I'm not going to repeat everything that Brian said, because that's definitely was our kind of our marching orders and directives how to get there. But I think I'll kind of translate this conversation, Russ, into the execution of that plan.
Please.
What we did here in locally Allegiant Stadium, the Raiders elected to go with the fully vaccinated audience, which means, or meant for us, is that I have two platforms to deal with. I have an event with fully vaccinated, and the other events, such as our UNLV game, Iowa State game Saturday, I have to have all attendees must wear masks because the event chose not to go with the vaccination route. With that being said, the dynamics of planning for logistics like that is all communications. As Brian mentioned, after that 8/16 announcement, I believe the Raiders made an announcement a few days after that saying we're going forward with vaccination, and continue to communicate that up to our Monday night kickoff this past month. So we had past Monday, had about 3 weeks of communication, which was key, what was going on. And as I'm sure all of us on this webinar have had some sort of pushback, and it's good, bad, or indifferent. Somebody made their opinion welcome to us, but it also took that as collateral to plan accordingly. So what we did was we started with communication, but it was also to the point of the guidelines we had to follow was who was going to verify our vaccination piece. So what we did is we partnered up with our local EMS provider, and we had them be part of that medical verification piece of that, because we're obviously as venue operators, we don't have that qualification. I want to make sure we got it done right. And as Brian mentioned about the perimeter, because our building is within our established perimeter of 100 foot, we found those guidelines. But what we did, in addition to the communication and getting everybody, hey, this is what we're going to do, we had to facilitate those who weren't going to get in compliance or did not know or don't have the communication pieces. So what we did here, we established a plan to put 2 vaccination tents on site. But within this vaccination tent, we also had we'll call it an additional screening verification for those kind of, we'll call it the gray area attendees that did not have one or the other, had nothing. And how do we explain that? So we put our resources to kind of get out in front of their arrival. We obviously the platforms, but when on game day, we were very concerned about that mass of people. We're a venue of 65,000. Opening night, Monday Night Football, first ever Raider game with fans in the building. So you can just kind of project what type of anticipation we had for this event, and all eyes on us technically. But what we did was we got ahead of it with the PSL holders, and the PSL holders, about 40,000. We gave them an opportunity to opt in, or if you're not going to opt in, we would offer you a refund or pause your tickets for the following year. It was their choice. We didn't force it on them. They made the choice, but they did it in phases, so we kind of knew what was going on. But then with the beauty of technology and the ticketing system, we knew who was coming out of town. So we actually reached out to the visiting teams and have continued to reach out to the visiting teams to inform their guests or their visitors coming out here of the process. All that communication seemed to work until the day of the event. We had, and when we did, in addition to, the local EMS provider, we had and thankfully to Brian and his team, we had a volunteer group, about 100 people from the LVCVA to support and help identify, be identified as somebody who can help you. Folks are coming from Vegas as a destination city. They spend a lot of money to come to the hotels, the air flight, the hotel rooms, the food, plus the game ticket. It's not cheap. So when they would come across to the venue and we weren't having any resources available to them, we had to solve that problem. So we reached out to the community. LVCVA was great, gave us about approximately 100 volunteers to help answer questions for us, because as we all are experiencing, there's a staffing shortage on event staffing. So we kind of pulled in our resources, and the local community of our business operators helped us. That was a big win. And why that was a big win, because when Clear gave us the support, unfortunately, the shirts they gave us were black, and our Raiders colors are black and silver. So it's kind of hard to get, identify that. So they had pink vests on for our volunteers. Getting the message out is key for us. So that was the one part, communication. Execution of the screening process. As Adina mentioned, she had it layered out in her at Barclays Center. Well, we did the same thing. We pushed our green screens, that we call them. So if you have a green screen on your Clear app, that means you were good to go. You've gone through the process, you've vaccinated yourself, and you're all uploaded, ready to go. The issue we ran into was there's a QR code that also validates a vaccination piece that we had to make in-game adjustment to notify our staff. And now these QR codes are also acceptable as well. So that was a little bit of a learning curve that we learned there. So our screening started outside, then they went into your security ticket, traditional ticketing, scanning, and security screening process after that. Very similar to what Adina described in her building. The one thing we did prior to that a Clear screening was that tent I mentioned. We opened up the tent Saturday and Sunday. We had a Monday night game. So over the weekend, we opened for about 5 hours each day. We collected we had about 4,000 people get vaccinated, newly vaccinated folks over the weekend. And then on game day, we had another approximately 15 to 2,000. So overall, that weekend, we had 6,000 people get newly vaccinated. So that was a big win for us. The other piece of this were back to the additional screening was age groups, kids 12 and under, or what do we do for them? They had to follow the mask mandate based on our guidelines here. Those folks who may have had one vaccination, you were able to come to the game, but we had to verify that you got a wristband, and then we actually put a hand stamp on them. Not only just a wristband, but a hand stamp. As we're aware, masks come off, they can take the wristband off, they're good to go. You didn't have to wear a mask inside the building, you're fully vaccinated. But we did see you with the stamp, we thought, no, you got to put your mask back on. And our event staff did a great job of enforcing that. But again, it was those dynamics you got to account for. So we did have a section within that tent to handle those one-off gray area conversations. I have a medical, we had medical religious, exemptions presented to us, but unfortunately we did not accept those for this event. And that's kind of where we are right now. There was I can go down the rabbit hole with a lot of different situations, but Russ, in general, it was definitely a comms piece that was needed. The day of execution to handle and filter out that guest resolution or service resolution. But also you guys need law enforcement around there. Wherever you guys do, it's going to be some conversations that you need. So don't forget the safety component overall. And then we'll kind of just shift gears real quick. I think Adina mentioned about the event staff. Our event staff in the building were all required to wear a mask, regardless of your vaccination status, because we don't know who's going what. We didn't have the authority to tell the vendors, but any vendor, contractor, anybody else, you had to wear a mask based on the governor's mandate. So that's kind of how we handle the event day staffing model. Russ, I think that's kind of a quick snapshot for me. I will answer questions later if that's anything else.
Yeah, thank you, Raul. Really good. What I want to do is I'm going to move now to addressing some of the larger points with this as a group, and I'll filter in any comments that I have versus just talking you through SoFi Stadium and YouTube Theater. But as we can see in the chat, and we'll go from the beginning down and make sure that each one of these gets addressed. There are some common themes in there. In looking at VenueNet today, and I think VenueNet once again has proved its value in terms of regardless of the size or scale of your facility or location or resources, you can get on there and really ask for and get some help. The motivation for us to create this discussion today, and from this perhaps another one down the road in another 30 days or so as we start to evolve maybe some more consistent best practices, was really the amount of discussion that was going on and some of the challenges that people were facing. So today in VenueNet and in the chat, we have questions that have to do with who's checking the vaccine cards. I will share with you that I made an assumption in Los Angeles that we would have to independently verify ID, the name on an ID along with the Vax card. And then going back to what the California code was, and with Los Angeles Department of Public Health, that's not actually a requirement. It's really good news that I got verified yesterday. So at this point, this is also going to address the issue of fraud. I would say, and while I can't speak for every health department in every state, I think that right now the idea is that we're trying to do the best we can to protect the most amount of people, and that there is not actually the resources and or the desire to go into a deep dive or the rabbit hole, Raul, as you appropriately put it, with regard to the forensics, with regard to some of this. The health departments are aware that there is fraud. There is fraud in the printed cards, there's fraud in the electronic versions, that kind of thing. But that, at the end of the day, they're hoping that people will do the right thing, and that right now have to just sort of accept what you have as a verifiable overall. Now, a little different for the Excelsior Pass. I think Adina can comment on this in a second, because that's a verification process through the state, through a state registry. And again, all 50 states have some different version of this overall. So what I have seen is security checking it as they enter the chute, as was described in terms of a new layer of in the process of your Vax check, your security screening, and then your ticket verification before you enter the facility. No matter who it is, there was a comment in the chat about HR or security or whomever. The key is actual training. And this actually ties into what's accepted for a vaccine. In the United States, according to the CDC, that we are accepting 3 vaccines. We accept the Pfizer, 2-dose Pfizer, 2-dose Moderna, and the 1-dose Janssen or J&J. But Las Vegas in particular is a great example of where people are traveling from all over, not just Canada, not just Mexico, but from around the world. And sports travel and tourism is back, which any of us who have had events here in the last few weeks can see. And now you have people that have gotten, I think there's 40 some odd different vaccines worldwide. But AstraZeneca, for example, is not acceptable as a vaccine here in the United States, although it is an acceptable vaccine in Canada, for example. So again, this goes back to my initial statement about having to verify what circumstances are you operating from in your local area, and it ties back to training, and it ties back to what Raul's point just made is communications, and those communications are internal as well as they are external. Does anybody on the panel want to just add anything to that?
Okay. Yeah, Rob, sorry, Russ, real quick on that, and as that communication is festered internally, because we do work closely with our partners because it's their client, I think the key to account for, regardless of the amount of communication, you have to have a day of communication plan that enhances that overall consistency. You got to put measures in there to prepare for that, because not everybody's going to be as in tune as we are. Oh, why didn't you see that? No, you have to plan for that day. We discovered that a lot on Monday, that the more people who were educated and had in the more robust information, we had to make sure that you plan for that. Don't overlook that piece.
Were there issues with people who bought the tickets off of the secondary market, for examples, who may not have been in the path of travel of your normal communications?
Absolutely. So what we saw here, I'm sure some of you guys may know, we had the most expensive ticket in the league, blah, 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 blah. Soon we made that announcement. Apparently all our secondary market prices dropped drastically, close to like 50% cheaper. So those folks who were coming the day of took advantage of it, weren't aware of this whole process. So that's where that additional screening kind of location came in. So that was the miss there. So whatever platforms you have available to you, please make sure, and it will do yourself a lot of patience you need as well. Do yourself a favor and plan on going for that robust enhancement on day of.
Well, everybody on this call suffers from the prepare for people to have not paid attention to any of the information that we've provided them. So that's not new to us. It's just that this is, depending on where they come from and what they're used to, it is just like when we enacted in the NFL and all major professional sports now the clear bag policy, people who weren't regular customers, whether they were from Buffalo or from Seattle, it didn't matter, really had to deal with that. The next thing I want to touch on is just advanced verification. I mentioned that we did our first vaccine verification event with Vax Fox Live on June 20th of this year. What I found is we had set up 3 locations in the greater Los Angeles area, and literally a third of my customers actually got advanced 2 days in advance, 48 hours in advance, went and got advanced verification. This took a tremendous load off of us in terms of getting that wristband and having those people be pre-verified, hold their wristband up and be able to skip the whole vaccine verification process. At that time, it was an external process and not really at the gates like we would more normally do it now. So as we are now moving in 15 days to go to vaccine verification, I am working with the teams to identify the zip codes where the majority of the season ticket holders are located in order to look for natural locations where we might be able to staff up and ramp up advanced verification for this. LSU had a big game on their campus last Saturday, and they opened advanced verification sites for 5 hours on the campus. If you've ever had the pleasure of going to an LSU game, you'd know that everybody gets there early and circulates the campus and all that. So terrific opportunity to impact those folks before they actually got to their doors, and to the degree that that Raul was talking about, anything you can do for advanced verification is going to lighten the load and solve many of those issues, and maybe identify some of the issues that are unique to your marketplace before you actually get to your gates. There's a lot of question about vaccine accommodations, the health, the medical reasoning, religious reasoning, or others. And unfortunately, none of the legislation that I've seen throughout the United States or the pending federal legislation, while we don't know what it says yet, there is some information about what's being thought of, has really addressed this as it relates to your customers. Now, it is fairly well addressed through HR law, both on the federal level and in your individual states. And so one of the things you can look to is SHRM, if you're familiar with SHRM, the Society for HR Managers. And so I think that the rules for our employees give us some insight into what the acceptable practices are going to be for our guests. And at the end of the day, some of it's going to probably fall into the level of just, you're going to have to sort of believe people. You don't, again, there's no ability, capability, or resources to go through an in-depth forensics with regard to medical condition, religious philosophy, all of those kinds of things. And in fact, you have a better, you have more time and a better plan to do that through your own internal employees than you would have with a guest who's arriving in anticipation of coming into your facility. So you can expect that there are going to be difficulties and challenges with that, but it's just like the recognition that there is going to be some amount of false IDs out there, or false cards out there. These are just things that we're just going to have to deal with until someone comes up with some specific direction. And I haven't seen any yet in any of the 50 states where I've been paying attention to this. So it's really complicated. It's not just a religious exemption, for example, but it's also an individual's right to interpret their religion. So it could not possibly be more complicated for us with less actual direction from the authorities that are directing us to actually to communicate this overall. Lots of questions about kids, and it was interesting, I think, and one of the questions to you, Adina, is that testing is not available for kids, but vaccines are not available for kids. And so in New York, can kids actually come to events?
Yeah, it's funny you mentioned that. Just today we got approval to not have to test children under the age of 12. So before today, we were going into this with that children would have to be tested. Age 5 to 11 would have to be tested, and anyone below that wouldn't have to be tested. But again, everybody would be masked up, would have to wear a mask. Well, today we got approval to not have to test children younger than 12 years old, which is going to help us with our Disney on Ice shows that are coming up. So those family shows, WWE, those types of shows, testing kids was going to put an undue burden on our operation. And so we were able to get kind of a waiver, if you will, from the city on that. They will have to wear a mask.
I think what we're going to find is that so some of the secondary and tertiary markets are probably going to look for what the larger markets are deploying as they're trying to come to some rationalization. That's why it's critically important that we continue to share information not only on VenueNet, but the people on this call or people that you trust, so that you can help support the decisions that are being made by your health department or your state's bureaucracy. I would share with you, which I have shared with many people on many of these calls, is that like your first responders in safety and security, this is not a time to not know your health department. Because if not, then a bureaucrat, and I'm not saying that as an explicative, it's somebody who performs a very important job in our government, but a bureaucrat may be making a well-intended decision without understanding you or your business and how you operate. And so being prepared and having access to information so that you can help guide the decisions that are being made locally, or even if it's appropriate on your state level, is going to be critically important to you basically surviving this. Because if a rule gets put in place, it is very, very hard to get rules undone. I think we've all experienced that in some way, shape, or form. So with that, I want to go to the chat, right? We're going to begin with Scott Loft. And it said, are you checking IDs with physical vax card checks? And I'll just start by telling you that from our perspective, and the rules that exist for us in Southern California right now, is the physical card itself. It is a photo facsimile of the card, so it could be a picture of the card, it could be a picture of, or it could be saved to your wallet. Or there are in Los Angeles two digital devices. One is CA Notify, which is a state registry, and another one with the Los Angeles County Department of Public Health called HealthVana. And so there are two digital opportunities, but those are the accepted manners which you can prove the vaccination card. Raul or Adina, Brian, you guys have any other insight in terms of how you guys are doing that?
I'll speak for what we did here with Clear. We used the Clear app. As part of your uploading of your vaccination card and your record, you actually have to take a photo of yourself. So when you're doing the visual check, remember you have a mass of people coming at our screening point. We're not scanning your QR code. You're verifying that you have it. So you see your photo with either your QR code or your green screen, we'll call it, and that's where you upload your own image. And it's pretty dynamic, and you can have a lot of people around you and everything else. And it refreshes every 30 days. So you got to take that picture of yourself, and that's how that validation, the ID verification happened on our side.
Okay, Adina.
Yeah, so we're still doing the old-fashioned way where we're checking IDs and against the vaccination cards or IDs against the Excelsior Pass. We worked with Clear before the vaccination piece came into play to upload testing data, negative to evidence that negative COVID test. And it did, help, of course, with the identification piece, because you do have to upload your picture, et cetera. But we didn't feel in New York City and in New York State, Clear was going to be able to provide us with any additional, support at this point in time with their technology. What we were wanting from them was that they would be able to actually verify vaccination cards, or be able to tap into the New York State's database on, the people who actually got vaccinated or other states' vaccination records, and they were not able to do that. We wanted that elevated kind of verification. So we felt like that since they weren't able to do that, the benefit or the value proposition of moving forward with them wasn't something we wanted to do at this time. But I do know that they're working hard on that, and so I think that's a space for everyone to watch.
We would all agree that a single source of truth would be immensely beneficial to all of us, but I don't think that that's in the near term. Lisa Elliott writes, what are the protocols for people who show up with a doctor's note saying they're medically unable to get a vaccination? What forms do you accept? This is another piece of that inelegant bureaucracy that I was discussing earlier. Unless it's written on crayon or something like that, or in Ukrainian, I think you're just generally going to accept something that looks like it's appropriate, and it's not just medically unable, but it's also the form that you're getting that says that you've had a test within the last 72 hours. This goes back to some amount of training for the people, whomever they are, who are going to be doing this scanning, because this is Again, unfortunately, it's ripe for fraud. But there's just no way currently, nor is there any mandated direction that I'm aware of anywhere in the United States that is specifying a specific set of criteria for this. Does anybody else have anything else to add to that? Okay. Let's see. Jenny, mandate for any one shot, not just the 3 vaccinations. I think it's just reiterating that that you're not requiring, Adina, the full 14 days from the 2-shot regimen from Moderna or Pfizer, or the 14 days from the J&J. If you can show evidence that you've had at least 1 shot, then based on your rules in New York City or New York State, that qualifies you to enter, which is very different from LA and very different than, I'm sure, a majority of the communities that are represented on this call.
Right. And it was very different for us too to find this out, because New York State, and even now New York State's guidelines are that you do have to evidence 2 shots if it's a 2-shot vaccine, and with the 14-day kind of window. But when New York City came out with the 1 shot, we're in New York City, so we're now following a New York City mandate, which is 1 shot. They haven't spoken about what happens with the 2nd shot, like if, people have to evidence a 2nd shot at some point, but I do expect that is going to be addressed in the coming weeks.
Okay. Pilar, Adina has already addressed the circumstances that they're running now with an exemption to be able to manage kids under 11. Jay Roberts, hello from to Denver, Colorado. We have discussed the specifics of the vaccination process. Again, I've talked to many people, and it's as many different groups as possible. There are people having training NPOs. There are people who are using security. There are using people who are parts of your staff that do not have game day responsibilities or event day responsibilities. That could be HR, that could be marketing, PR, it could be accounting. There could be a lot of people, and I would think that we are all collectively suffering from the same thing as it relates to staffing, particularly in our casual and our part-time staff. So if there's somebody that has too much staff right now, you have our respect, because I think all of the rest of us have our oars in the water trying to figure out how to survive that. And with regard to a calculation, I think literally, if you're doing it on like extending the lanes that are going into your security screening, then it's really 1 per lane. And if you're in an NFL stadium, that could be anywhere from 90 to 140 lanes. There aren't a lot of extra people to do that, so you're really looking at that and then redeploying those people to fill your in-bowl positions and that type of thing. So it can be quite a burden depending on the market that you're in. Callie, who within your organization is checking the Vax cards? I think we just talked about that. It is. I don't think anybody is duplicating that process with the ticket scanning. That would be way too onerous and slow things way too down. We have addressed under 12. I did have a question from a client yesterday that said, "Hey, are you sure kids can be tested?" Yeah, kids would be equally irritated as we adults are to have somebody swab your nose, but it's not harmful. So kids can be tested, and again, it goes back to your location. We just discussed the 1 vax shot versus the full vaccination. Julie Gallagher, locally patrons must show a vax card or proof of negative test 72 hours. For employees, if not vaccinated, you must show a weekly negative test. Again, this goes back to local criteria. And what you just described there, Julie, is really where the federal criteria is going in terms of you will be vaccinated or you will be tested on a weekly basis. Cindy Moore, provide the spelling of the partner you use to validate the vax. I don't know. Did anybody mention a specific partner?
I may have said ambulance, which I've actually responded directly to her. So there's a company in our area, and they do have other kind of areas that they operate in. And California is one of those areas. It's called Ambulance. It's AMBULNZ.
Okay. Very good. AstraZeneca, we did mention that briefly. It is an accepted shot in Canada, but it is not accepted in the U.S. And I think, again, this is back to a conversation with your health department. I'd be very surprised if your health department is going to allow a vaccine that is not accepted in the U.S. as acceptable into your facilities. But listen, that might be a lot different along the Canadian border in the Northeast than perhaps it would be in the Southwest, for example. And so it goes back to making sure that everything that we've said on this call has to be really adapted to your local environment.
Hey, Russ, there's a couple of good questions also
go ahead.
outside of the chat. If I may interject these two
Sure.
real quick. They're real common questions as well. And one of them might have been answered, but I'm going to go ahead and share it anyways, is how, Bailey, welcome Bailey, how are they handling ADA exceptions for people who can't get vaccinated for health reasons?
So the CDC would tell you that they would advise you to wear a shield with a drape. I don't see anybody in America wearing a shield with a drape. I haven't seen it yet, but that's the CDC's response. But shield, maybe shield again. You got to go back to your local health department and say, hey, what is your direction to us? What is it that we can do? Because it's certainly possible that you, for medical reasons, may not be able to be vaccinated. But does that mean you can't wear a mask or a shield or a combination of mask and shield? And if that's the case, if you can't wear a mask, let's say CO2 or breathing issues, that type of thing, is the shield going to be acceptable? So again, not a real elegant answer. Like most of our conversation, it depends on your local operating environment overall.
Thank you, Russ. And then Maura had another good question. Welcome, Maura. And that is, has anyone experienced multiple escalated situations with a non-compliant person regarding vaccine versus negative COVID test checks? We know that's going to be a very common concern, but has any of you panelists experienced that?
I don't think we're deep enough in it yet to really have dealt with some of these things that will reveal themselves over time, which is why we may be coming back together here in a period of time and really talking about some more of those lessons learned. Okay.
We also had a good question: is what percentage of patrons would you estimate come with a negative test versus proof of vaccination? And have you found some of these people are not coming solely due to the vaccine mandate?
Raul,
I can only speak. I can't, again, to what Russ said, we haven't gotten deep into this yet, but when we were in a situation where we were accepting both the vaccination and the testing as an option, the majority of the people coming to the event were vaccinated. And so in the very beginning, it was probably maybe 20% of the overall attendance were vaccinated. That was for our playoff game, say at the end of May. And then by the time we ended our playoff run, that was above 50%. So over 50% of the people were coming in vaccinated versus those that had to go test.
Raul, any idea what that was like Monday night?
Yeah, well, again, kind of back to that pre-event communication, we had close to, I want to say, it could be off a couple thousand. We had close to 37 to 40,000 already vaccinated, pre-screened, through the system. 40,000, I'll say the high end, pre-screened, ready to go for our event. Which again, in our venue, 65,000. That's 80%. That helps us a lot. Back to that communication piece. And that weekend, ramp up helped us as well. That was going into the weekend. So we ended up, just having, I would probably say close to 80%, 85% that were pre-screened vaccinated. However, we did not deal with tests. You had to be vaccinated or nothing. So it was just purely vaccination. I would say 80 to 85% of our crowd was already ready to go.
Yeah. Again, Scott Loff asks Adina, with your vac sweepstakes, what percentage of your part-time workers from the 20% that it was before, where do you sit now with regard, how has the sweepstakes helped with your vaccination of your casual staff?
So stay tuned on that, because we haven't had enough events yet for people to enter. Remember, they enter through the number of shifts that they work, event shifts that they work for the most part. And so this is the week where we'll start to kind of see really how well the sweepstakes actually helps us, because this is the week where we're starting to have events after that September 13th kind of deadline. But I will tell you the actual mandate itself, at the beginning of August, we were, less than 20% of our employee base being vaccinated. That mandate jumped us to above north of 50% of our employee base being vaccinated, and it continues to go up from there. So that alone encouraged people to get the vaccination. So we'll see how the sweepstakes, if the sweepstakes actually continues on that momentum and gets us even more employees vaccinated.
There is a question in the Q&A, not the chat, that really talks about the recording. So either later this afternoon or by tomorrow, this will be up on the VSG website and on our YouTube channel. So if you have missed a portion of it or you want to share it with others, just know that this recording will be made available to you. What is the huge challenge in this restart? And restart from being paralyzed by COVID, restart plus vax, restart plus max. Would anybody disagree that the huge challenge is labor? Does anybody on the panel have a bigger challenge in that one? Yeah, okay. Liz Singer asks Adina, I'm curious about what the vax pushback objections are. Have you experienced anybody who's basically come up with the reasoning why they didn't want to get the vaccination other than health or religion?
No, not other than that. And at this point, or at least they're not voicing it to us or to our HR department. I mean, I think one of the things that the mandate has helped with is that we don't hear about all of these other kind of reasons anymore, because the mandate, basically has said, of course, it's a medical or it's a religious. And so there's not a lot of chatter about anything else at this point, because now, we're forcing people to put, some money where the mouth is, if you will, and actually come to the table with either that medical exemption, which is pretty clear cut. With us, the doctor, you have to get something from your doctor saying that you are exempt, not something that comes from some other professional or from the actual employee themselves or the patron. The religious exemption, as you know, is a little bit more challenging, because if you can't really question somebody's sincerely held beliefs, etc. So that's a little bit more challenging. And if we're providing any accommodations for our employees, it's probably in that bucket. But we are looking at, when it comes to employees, just so you know, whether we're looking at whether or not their position is fan facing versus non-fan facing. As one of the ways we're determining whether or not an accommodation or an accommodation is being offered based on an acceptable exemption.
Okay, very good. Next question had to do with throughputs. We're talking now about just adding another step in an already complex step: approach, arrival, entry through security screening and ticket verification, and now adding a step on the front of that. And so, yeah, I think, I don't know that collectively we have enough experience yet to really know what those implications are, but I think you can imagine that that it's going to exacerbate it. If you're talking about an NFL game with an average of 2-hour doors, literally that first hour, depending on your market, is somewhere from 3 to 5% people are coming in that first hour, and everybody's coming in that next hour. So it is going to take an already challenging late arriving crowd from tailgating and the like, and exacerbate that situation. I'm pretty confident in that. We've addressed who's verifying. Brian Pyler asks, have you had clients who want to do a fully vaxxed event with a mask requirement, or are people resistant to this mitigation?
So our first fully vaxxed events will be next week, next month. And all 3 of those have determined that they are going to take advantage of the mask exemption and not wear masks in light of being fully vaccinated. It's one of the reasons they're doing the fully vaxxed. But as I mentioned earlier, they feel like it will be generative for attendance for both exhibitors and participants. So not yet.
So, and Mark, we're coming back to you. Mark asks, how do you layer events in a convention center setting that have different vaccination requirements? Attendees from these will inevitably commingle. I mean, I don't, that may not have occurred yet in sort of in Las Vegas, but I'm sure that some of this is already occurring in some of our smaller centers. Has there been any discussion about basically if one group decides to do one thing, does everybody have to do at least that thing or more?
Yeah, so we're fortunate here to have the space to allow for that distancing. It really comes down to the creation of the hard perimeters that I mentioned, and how those are drawn. The beauty of the flexibility of our space is such that we can create separate reg spaces, entry spaces that are completely divorced from neighboring shows, allowing those perimeters to be essentially impenetrable. It will also, though, and we do have some examples of that in the future where we have vax and unvax shows. It will also apply to our employees, though, because the shows, part of the request of the shows is only vaccinated employees can service those events. So it's causing us to have to divide our staff into vaccinated, unvaccinated, with the unvaccinated being able to address all the other business in the building, while the vax are focused on the fully vaccinated shows. Just to layer in some thoughts on vaccinated employees. So as many local governments here in the state of Nevada have done, we, prior to the president's mandate, had implemented a vaccinated or weekly testing policy. And what we found was across both bargaining unit and non-bargaining, we were at about a 73% vaccinated rate, which we were pleasantly surprised by, higher than the national average population. What we have seen, though, is the added friction of a weekly test for those folks who are unvaccinated are starting to sway some of them toward the vaccination side. We have about 16 people now, which is a small percentage of our 350 person staff, that are going through the vaccination process as a result of that mandate. So it does work. It does start to convince people it's not worth the aggravation to go through the weekly testing, and it's been beneficial.
Well, many of the people on this call have heard me say that pain and inconvenience are the only things that change human behavior. It also ties in, your comment about the show producers ties into the moves that we've seen Live Nation and ASM Global and others from a promoter standpoint, but also the desires of the actual artists themselves are dictating a lot of the responses, regardless of what you may have set up or what's appropriate in your market overall. Vaccination requirements impacting event labor headcounts. If I was in a market where we demanded all our employees would be vaccinated, I would lose 40% of my casual employees. Now, I hope, Brian, you're right that having to go through the inconvenience of the testing will motivate more people to actually do it. But it would be a catastrophe if we ended up having to have 100% casual staff vaccinated overall. So we have addressed what happened. Raul brought up about if they purchase through the secondary market without proofs of vaccination. So as much communication you can do, but also being prepared to how to mitigate that. You do also mention, Jonathan also mentions these at-home tests. I have a bunch of these, and I've actually bought every test kit over this entire 18 months that's ever come out, and try them on myself. The at-home test is actually pretty sweet. I'm disappointed that it took as long as it took to get out. It's about $27 in Los Angeles. You get 2 tests for that, 15-minute antigen test. The efficacy is equal to the $80 test. And so hopefully that will help with some of the last minute things and maybe some of the things that happen from a contact tracing standpoint in your staff overall. This is a long one here. Between the key to New York City and NYS Heroes Act, how are you handling your non-employees, meaning third-party vendor representatives, crew, press, etc.? Depending on how the language is interpreted, there can be different approaches for third-party vendor reps who are in the building regularly. What do you what are you causing or calling your third-party vendors to actually do for you with regard to vaccination or testing?
So for us here, the third-party vendor was responsible. All of our third-party vendors were responsible to make sure when, like I said, the event day staff, they had to wear their mask, right? We had to enforce that. But I think it comes down to not controlling everybody else's operation and being responsible for their own. When Russ made the comment, we had to require everybody, we lose half our staff, and that's the issue. We still got to be safe. And the key was to everybody on event day, including myself, and I'm from an ASM perspective, we had to be fully vaccinated, and we are. I started to wear a mask around everybody else on event day. So that's kind of where that line kind of is drawn in, but it's more about the safety component for the holistic operation of the building. It is a business impact if you lose, get people taken out for contact tracing, et cetera. So we still highly encourage the mask wearing and enforce it and require it on event day staffing as well as our own.
Adina?
Yeah, so same thing as Raul. We require that everyone wear a mask, or all the employees wear a mask, even though now that our fans actually don't have to wear a mask with this new mandate. But our third-party vendors have to provide us with staff if we're working with them that are vaccinated in order to be able to work at the building.
Okay. Let's see. The comment about, there's a comment about to hold fully vaccinated shows but not mandating masks. Again, I think this is which way is the wind blowing, and depending on what's happening with the virus or the Delta variant in your operating area, might cause you to make changes to that as you go forward. Cindy's asking about underage kids, ages 12 to 15 that don't have an ID. Again, for me in California, if they had a vaccination, they don't require me to actually test a second or verify a second ID. So it wouldn't be an issue for me, but it might be an issue for someone else in the marketplace. And we're clearly over. What if you anticipated an hour? I indicated we will stay on and continue to address these questions. So you're welcome to join with us. But also, if you've got other obligations, we understand, and the rest of this will also be available sort of on the YouTube channel. So we understand and appreciate the 246 of you that are still left, which is very unique for a webinar. So let's see. Adina addresses the request for exemptions from patrons in advance. So okay.
Well, to that point, Russ,
Yep.
At this point in time, so if we've been told that it's seen as an undue hardship on our business to try to vet exemptions at the door. So people that show up at the door wanting an exemption, we're not in a position to be able to deal with that. So, and we've been allowed to go with that.
And that's where again, to Raul's point, that's where your communication, as much advanced and even on-site communication as people are approaching and arriving, is going to be critical to executing that. So Tracy asks about state digital driver's licenses. The Excelsior Pass is a unique situation in the US. I'm not sure I'm aware of anybody else that's like it right now. And I know that depending on where you're located, tying all of this back to a central state database can be a challenging discussion. So I'm not exactly sure where that is headed. So Tracy points out that you can add your driver's license state IDs to your Apple Wallet. It's just the same way as you have with your ticket. We encourage everybody to make sure that they have taken a photo of both sides of their Vax card and have that in their wallet, and also in their camera photos, that type of thing, because that is acceptable for us as we move forward. Let's see, 12 and up, we talked about ID verification in New York, names match. Again, I was surprised. I made an assumption that we would have had to do the same type of dual verification, that the name on the card would have to reflect another piece of ID, not necessarily a government issued photo ID, but a Costco card or a student ID or credit card or something like that. But right now in California, that is not the case. So let's see, trying to catch up here. Karen McCarthy is any WHO recognized vaccine is eligible for venue entry. And she mentions the Novavax about to be recognized by the FDA. Again, I would go back to your local health department and just find out what's appropriate in your operating environment. Yes, Jeff, the recording will be available. It's at VSG Advantage Training. Ambulance, we have that. LA County Department of Public Health advised us that we could accept verification of any WHO vaccines. Well, that's great news. I wasn't aware of that. So thanks for, Carissa, thanks for sharing that information with me. That helps. Let's see. Claiming a patron claiming we're instituting a dystopian society. That's a different webinar, by the way. So good luck with that. Wristband for that single game. Raul, that wristband is on a game by game basis, not, you don't have the wristband for the season, right?
That is correct. It's a game by game. And what happens, and just on the Clear app perspective, you have to refresh your image and refresh your everything's, like I said, 30 days. So that's helps us keep making sure it's for event specific.
Yeah. Bridget asks about how far in advance. All of the everything from the CDC on down really talks about 72 hours prior to the for testing, for example, 72 hours prior to the prior to the event. Let's see. Greg has put some information in there from SHRM. Thank you for that, Greg, and also Sean Navarro, some LA County additional information. Mark has some more SHRM information in there. So that's good. Are you, Eric Granger? Hello, Eric. Are you accepting any form of testing, including take-home tests? You know, it's an interesting concept because, you know, for my own employees, I'll accept a take-home test as long as it's got like the front page of today's newspaper or something that verifies sort of when it was taken. But I think it would be a nightmare to try to figure out how to manage a take-home test as an acceptable result as we're trying to clear people from entering the event. I don't know. Does anybody else? Any of you guys have?
I would just add to that, Russ, is that when we were accepting tests, we did that for our premium patrons. So for the suite holders and patrons in certain seating locations, we did allow for a take-home test, but we mandated certain tests only, though. Okay. So we knew we did have that to be able to verify.
Mark Herrera has shared the CDC has updated their testing communication toolkit. Lots of, you know, that site changes every day. You don't get a notification when it changes. So if it's not you, I would say get somebody on your staff, somebody who you want to punish, however you want to look at that, and then make them go through the key points of and portals on that staff, that because you never know as it's changing. So Eric Culberson, so that was a waiver and not a blank decision by New York City. So, and again, Adina, you said that was a waiver and not just a New York City decision. Is that correct? The Vax card verification service that you mentioned, I mentioned Health Vana. That's LA County Department of Public Health, or CA Notify, but Washington State has like Washington Check or Washington Vax. Also, I would share with you a nice shout out to Climate Pledge Arena. They've got a terrific web page with regard to a lot of the things that we're discussing as it relates to the opening of that new facility. And so they've done a really fine job up there. And so encourage anybody that's looking for a template to look at Climate Pledge Arena as it relates to vaccine verification and COVID protocols overall. A great, someone asked, is there a great app not clear? There are a lot of apps. I think that we generally have the most experience with Clear just because of how deeply they're embedded in the verification process for TSA. But I can't cite any other apps off the top of my head. But I know that there are a number. I know that there are a number of out there. So. See, somebody, Jim Kelly is saying that we're looking at bin Bindle. I don't know anything about that, but maybe that could be something. For Raul, I believe you mentioned partnering with local EMS provider. What local EMS company did you guys partner with? And I don't know if we still have you, Raul.
No, I'm here, Russ. Apologies. Yep. There's a back here. We partner with a local partner called Community Ambulance. Okay. Local EMS is our service provider, and they were more than willing. But then there's the more advanced you give them, because they're struggling with staffing as well. So got to get them some consideration for time. So there was Community Ambulance on our side.
Yeah. Bruce is asking about the cost involved using an app platform. Who's covering that cost? I've seen a lot of people that are. I've seen a lot of people that are just transferring that cost to the ticket price. In fact, and maybe even some other COVID-related costs. Back to Scott Loft. We are likely to use feedback, which is the same system that American Airlines Center is using for Vax card upload. So again, if you check the chat, it looks like that we're getting a number of these things in there for you to look at. From Michael Marion to Adina, how has this Vax mandate affected your concert sales? How were the refunds on shows that were already on sale?
Yeah, so I think that initially when this vaccine mandate came out, I think it did cause the sales of most of our shows to stall a bit. Like I think it, slowed those sales down. Since then, though, at least for the ones that we see coming up in the near term, those sales have picked back up again. We've got Mark Anthony on Sunday, and those sales are starting to kind of pick up this week. And then as far as refunds are concerned, I don't have a percentage. There was definitely some refunds that were requested. Not an alarming amount did we get come back as far as refunds were concerned on these near-term shows. As far as the longer-term shows, even less than that. I think people are just kind of waiting to see, what may happen, if something may change or what have you. But yeah, I hope that helps.
Lyndon Bolin on this same subject came back and said that they require all employees, volunteers, vendors 100% vax and plus a vaccination or negative test within 72 hours. They're refunding an average of 10K a day, but are also having a lot of new sales based on the policy. So it looks like that might be balancing off. Greg Wolf mentions the Binax Now with Abbott. And I did talk to somebody yesterday who is trying to make a connection to Abbott directly to get a direct pricing versus pricing coming through a CVS or Walgreens. So, Adina, are you trusting that the vendor has verified their staff, or are you also confirming the proof yourself?
We're confirming proof with the vendors. Mm-hmm.
Yeah, and the same thing for me. I do the NFL verification at my building, and because we could be audited at any time, you really have to be 100%. I have to be able to stand in front of the NFL and assure them that that I have actually verified each and every one of those credentials that has gone out for people who are going to be in the ecosystem close to the players. Eric George, love to have another call with those of us in states with very different requirements. I'm in Arizona, no state requirements. Eric, reach out. Listen, we're on board with doing anything we can to help the industry overall. I would say reach out to Mark Herrera is the best place to go. Lanice Foley at the Bushnell in Hartford comes back to that she has reached out to Abbott, but still waiting a response. Any place that sells Binax Now in bulk, I'm not aware of it. I think right now it's really the only places I know of it in Southern California, by the way, is just CVS and Walgreens. I have not seen it in any other locations. Let's see. Colorado has created the My Colorado app, just like the Washington app. I think maybe most states probably have some version of that. Let's see. Excelsior Pass can be recognized by other states. So again, you'd have to go back and look at your state, and also with the Excelsior Pass, that's pretty consistent in terms of what we've said already about really understanding your own operating environment overall. Let's see. We're a week plus away from our very first test Vax event. Does the panel have any notes of surprise issues that they didn't expect from implementation? I think Raul's point about the secondary ticketing and how people have bought tickets for gifts and how they have moved sort of out of the path of direct communication and being prepared to actually manage that on the site during the actual approach and arrival during the event is probably some of the best advice that I've heard on the panel today. Certainly something that I will take to heart. And then there's some more on here about the Abbott test. So listen, we have, I hope we've addressed everything that you hoped to be here. It is our goal to try to provide actionable information to you, and really a lot of great dialogue. I'm deeply appreciative of the panelists. I really want to thank Mark Herrera and certainly Richard and Adam Cook for helping to support us in all of this.
Russ, if I could, I just wanted to parachute in with one quick thing that I stumbled across. I'm in San Diego at some unrelated meetings. I had an opportunity to visit the La Jolla Institute of Immunology, which is the leading research center probably in the world, 300 scientists. Interesting mask thing, and I wanted to show this. Some of you have probably seen it. I have not seen it, but I'll show you this if you can see it. They've got it branded, not a political statement, but it says, "I'm vaccinated," and it has their brand on there. I was showing this to some of the folks at the Honda Center last night, and they began thinking about how they might use that with their staff. So I just throw that in. And then also, as I think most of you know, for free on our website, you can check out the blogs. We've just put a blog up about enthusiastically getting event staff back to work. So hopefully you may find some value in that as well.
So again, deeply grateful to everybody for their participation, for all of you in the audience. I hope that we have met your expectations, but listen, we all have emails and we need to hear from you. And if we're called upon to put something on in the future where we have learned a little bit more real-time information, really looking forward to doing that. So with that, I'll say what I always say, which is be safe out there. Cheers.
Good luck, everybody. Be safe. Take care.
Thanks, everybody.